My name is Fiona Pringle and I'm the Clinical Nurse Manager at the Oxford Fertility Unit. I'm here today to show you how to administer your Menopur. You've been prescribed Menopur by your clinic and you should have been shown by them how to use it. You should have received, when you got your drugs, a box of Menopur75IU ampules. You will also have received a sharps box, 1ml syringes, some pink needles for drawing up the drugs, some much smaller yellow needles in which to administer the drugs with, and some plastic ampule snappers. When you're ready to administer the drugs, make sure you've got a clean, dry surface and that you've washed your hands before dealing with the drugs. When you open the box, what you will see inside is 10 vials with a blue top of powder and 10 ampules of diluent. The blue top flips off, so just put your thumbnail underneath it and snap it off, and it should come off quite easily. You can now dispose of the blue top. What you will see is a rubber bung in the centre of the top of the vial. In order to prepare your needle and syringe, ready to mix the drugs, take the packet with the syringe in and peel it open. Take the pink needle and again peel the packet open and attach the needle onto the syringe, pushing it firmly on. This is now ready to mix the drugs. Take your vial of diluent. If you have diluent in the top of the vial, you need to ensure it's all at the bottom. So just flick the top carefully with your finger to ensure the fluid drops down into the bottom. If it doesn't drop down immediately, just rotate the ampule with a circular motion and then flick it. You will see there is a blue dot on the top of the vial. This is the weak point in the top and is where it will snap. In order to not cut your finger, take the plastic ampule snapper, place it over the top of the vial, place your thumb in line with the blue dot and snap, preferably away from your body. You can now dispose of the top and the ampule snapper in your sharps box. Take the cover off the needle and syringe, put the needle into the liquid and pull the plunger slowly back, sucking up all the liquid. Make sure that you've got all the liquid into the syringe. You can now discard this ampule in your sharps box. Take the syringe and pop the needle through the very centre of the rubber bung and push the plunger slowly down. As soon as the powder gets wet, it dissolves, so you should now have a colourless liquid in your vial. Check the vial carefully to make sure all the liquid has dissolved. Turn both the needle and syringe upside down and making sure that the needle is in the diluent, slowly now pull the plunger of the syringe out and suck back all the liquid. If you find you've got a big air bubble in the syringe, push the plunger back up again and then pull it out. Once you have sucked all the diluent out, you should have 1 ml of liquid in your syringe. The black top of the plunger should be level with the 1 ml mark on the syringe. If you've got air at the top of your syringe, you're just going to need to slowly squirt it out until you see a drop appear at the top of the syringe and needle. Once you have mixed the drug, pull the pink needle off and dispose of it in your sharps bin. Take the small yellow needle, peel the packet back, firmly fix the yellow needle onto your syringe, pull the protective cap off it, and you're ready to inject. Your clinic will have advised you of the best site in which to inject these drugs. Some patients will have been prescribed more than 75 units on a daily basis. If you've been prescribed 150 units, you will need to mix 2 powders into 1 diluent. If you've been prescribed 225 units, you will need to mix 3 powders with 1 diluent. The process is exactly the same as for mixing a 75 IU ampule. Take the top off the diluent, suck it all up into the syringe, squirt it into the first powder, dilute it, draw it all back up into your syringe. Again, being careful to make sure that you've got all the liquid. Once you've drawn up the first 75 units, flip the top of your second vial of powder, insert the needle again into the centre of the rubber bung, squirt your 1 ml of liquid into the vial of powder. Again, it should dissolve immediately. Invert the vial and slowly suck up the mixed liquid. You should now have 150 units in 1 ml of diluent. And repeat the process if you're going to do 225. So you've then got 3 ampules of powder mixed into 1 ml of the diluent. Change the needle as before to the small yellow one, and now you're ready to administer the drug. Your clinic will have told you how many vials of powder to mix into the diluents and what your daily dose is going to be.